All right, thank you. Good afternoon, everyone. Welcome to the monthly meeting of the Allegheny County Jail Oversight Board. I'm Judge Kim Clark, the chair of the board, and I'm going to do a roll call right now so we have a record of our board members that are here. Ms. Hallam?
Here.
All right, Mr. Fitzgerald?
Steve Porsche sitting in, Your Honor.
Thank you. Mr. Camara? Ms. Klein?
Here.
Judge Lazara?
Present.
Ms. Moss?
Here.
All right. I know Sheriff Mullen's not attending, but I don't know if anyone's filling in for him. Sheriff Mullen? All right. Ms. Wagner? She's here. I know, because we were just talking. All right. Have I missed it? Oh, go ahead. Ms. Wagner? All right. Have I missed anyone? All right, and just to reiterate the rules, we just ask everyone to be respectful. Everyone will have the opportunity to be heard, but everyone will be treated with dignity and respect. There's no exceptions to that rule, and so I think we're ready to move forward. So our first item on our agenda is a presentation by Ms. Dalton. I think it'll be something that the board was probably not aware of. And so it's a presentation on stimulus money for transitioned aged youth in the Allegheny County Jail. Ms. Dalton.
Great, thank you, Judge Clark. Hi, everybody. I'm gonna do what I normally do and share some slides, and I'll talk you through, and happy to get any questions or comments you might have. So hopefully this all works. You can see my screen?
Yes.
Yep, okay. Oh, huh. All right, we're good, right? Okay, so just a bit of background. This will be a pretty quick walkthrough, but happy to share more with anyone if you're interested. So this is a federal program, came out during the coronavirus in an attempt to provide specific help for young adults who have experienced the child welfare system. So you can see on my slide, so in May 2020, a national study among lots of other research found that young adults transitioning out of foster care were really struggling, period, and especially during the pandemic. And so the federal government and Congress appropriated funding for, and there's some technical language in here that's technical to these systems. I'll try to make sure that's clear. What we call Chaffey eligible youth, and Allegheny County received $3.7 million in one-time funds. Chaffey eligible means young adults between 18 and 26 who are in child welfare placement. That's things like foster care, but definitely could be kinship care or group care, who are 14 plus when they experience that care. So anyone 18 to 26 essentially today during the eligibility of the program who experienced foster care. And so the goals of the program were to provide low barrier direct financial assistance to as many young adults as possible, to reconnect those young adults to not just financial resources, but other resources. And then we also were, of course, interested in understanding how that financial assistance could impact those young adults. So, oh shoot, what am I doing here? Hold on one sec. All right, there we go. So just a bit of, hold on one second. Give me 1 second. Oh, I see. Just give me one more second. Sorry. We had hidden this slide. That's why it's not there, but I wanted it. All right. I'm back. Okay. So just a little bit about the way we outreached to these young adults. And you'll see that some of them, of course, were in the jail. That's why I'm talking with you about it, and how we communicated with them was slightly different. But across the whole program, we partnered with lots of community groups, and we reached out via phone calls, via text, emails, social media. We wrote letters with my signature on them. It's hard to write a letter to young adults that doesn't sound like we're trying to get information from them that tells them there's free money available. I learned that doing this work. So We were pretty successful in reaching out to people. We met our outreach goals. Close to 100% of kids in child welfare care or already connected to aftercare services like the 412 Youth Zone, and over 60% of kids who we were not in contact with responded and applied via this website that we set up. You could just see the text messaging that we did on the side there. So we attempted to help them get through the process, made the application as low barrier as possible. So just a bit about some of those results. We did not have a ton of time. We had very little time to launch this program and close this program. So we launched on June 7th. We closed on August 22nd. We distributed 2 payments of $1,000 on each payment, so $2,000 total to 1,900 young adults, including 66 young people who were in the Allegheny County Jail. And we connected a lot of those youth, so 1,200, to other resources. And we also collected a bunch of survey data that helped us to understand how they were using those dollars. I'm not going to read the quotes. Those of you that are participating, unless somebody wants me to, those of you who are participating can see them, but we included some quotes from people who received these dollars and how important they were to their lives at the time. Just a little bit more about payment. So about $1,000 was sent to about 1,900 youth, and we used PayPal, which is maybe not the most modern way. Venmo and some of the other newer things would have maybe even been more modern, but was new for us. And we also distributed checks, and then another second $1,000 to 1,864 youth. Some of the kids that were in the program initially were no longer eligible due to their age. So over $3.7 million directly to young adults. So 66 of those young people were in the jail at the time of the program, for a total that we were able to release to them of $112,000. So I'll just say you can imagine how difficult it is to launch a program like this so quickly. And I think lots of places around the country were happy with whatever they got out the door and didn't take the time to try to really reach these young people in the jail. I'm very grateful to the folks in the jail, the warden and his staff, in particular to Amy Kroll, who really went extra mile to think through with us and help execute on getting this funding to the young people. So the way it worked, it's maybe a little bit more detail than you need, but the way it worked for persons who were incarcerated, they received, while they were in the jail, $200 on their commissary account. Amy Kroll went and talked to each one of them individually. We gave them a resource packet, and then depending on what they were eligible for, we released the second payment, which was between $800 and $1,800 to them upon release. And the way that worked is that the Discharge and Release Center would notify our justice-related services, Transition Age Youth Forensic Services Group, when the recipient was released from the jail, or will be released from the jail, and for kids who are still there, young people that are still there. And then either the youth would reach out, or if they didn't, we reached out to them and we met them and provided a gift resource backpack with all kinds of supports, as well as their additional dollars. And then that group also connected folks to the 412 Youth Zone to address any immediate needs, and as well as other resources, Kids Voice for legal support, Opportunity Passport for financial wellness. So this was an ability, create an opportunity for us to engage with these young people about other needs they might have. Just some high-level findings from the survey. This is not for the incarcerated persons. This is overall. Young people were most likely to spend money on bills, housing, vehicle and food expenses. Youth reported having enough money to meet their basic needs. More after those pandemic resources, so 35%. Still not the majority feeling like they could meet their basic needs, but over 10 percentage points higher than before receiving those dollars. They reported decreased financial anxiety, and they were more likely to report being employed. So that's nice to hear. We're still working on survey results and feedback from incarcerated persons. That's the Transition Age Youth Forensic Team is doing this contact. So we only have 16 here. But the top ways that recipients reported that they wanted to spend their money upon exiting the jail was just, what you would expect: clothing, housing, rent, parent and child expenses. And the top 3 needs upon being released from the jail were housing, finding a job, and getting identification. So just wanted to share a little bit about this program, and again, express my my great thanks to the warden and his team for helping us to get these resources to folks. So I'm trying to stop presenting now. Yeah, it doesn't seem to be working. That work?
No,
Sorry, my computer. All right, sorry, I'll get it off and just as fast as I can.
that's okay. Does anyone have any questions for Erin about this program? I think it's really great in that the eligible youth that were in the jail were able to benefit from these funds as well. I know that some of the kids that I have, for some kids that have sort of aged out of foster care that are older, I have their cell phone numbers, they have mine. So I did text some of the kids that I knew were eligible that could apply for the funds, and they were really grateful for that, because even the ones that are doing pretty well, $2,000 potentially is a nice chunk of money to have. So I just, thanks for that opportunity. Does anyone have any comments or questions? All right, thank you. And we'll give another shout out to Amy Kroll. All right, so then we can move to our community corrections reports, the program for offenders.
Good afternoon, Your Honor. It's Michelle Morse reporting for the program. I just wanted to say that we have wanted to let the board know that we're going to be hosting another vaccine clinic on November 11th for our booster shot for about 10 to 11 of our residents, and about 30 of our staff members have already signed up to receive their booster shot. Yes.
Right.
So that's all we have for this month.
All right.
Thank you so much. Thank you.
Does anyone have any questions for Ms. Morris? All right, renewal.
Wanted to let the board know that we're going to be hosting another vaccine clinic on November 11th for our
Renewal.
Yes, good afternoon. This is Adam Zach reporting for Renewal Incorporated. Due to the pandemic flattening out and the easing of restrictions, community service opportunities have once again opened up for our men and women. In the past 2 months, they've been volunteering at Mount Eric Church, the Urban League, and Project Destiny Food Bank. This weekend, we'll have several volunteers at the EQT 10-mile race, and we are anticipating even more events in the upcoming months, especially around the holidays. And that's all I have for this month.
All right. Does anyone have any questions for Mr. Zach? All right. And then last but not least, electronic monitoring.
Thank you, Your Honor. Steve Eswine for the probation office. Currently, we're just sitting, our numbers are increasing. We're just under 600 individuals on the bracelet. And during the last reporting period, 95 individuals did successfully complete the program. So that's all I have.
Any questions for Mr. Eswine? All right, thank you. All right, then we'll move to the review of the minutes from our October meeting. And again, I just want to thank Ms. Carroll for all the work she does getting those together and getting the packets out to the board. It's a lot of work and we really appreciate it. So the minutes were sent out to you. I hope you've had an opportunity to review them. And so at this time, I will entertain any additions or corrections or a motion.
So move that we adopt the minutes.
All right, there's a motion by October meeting. And again, I just want to thank Ms. Carroll for all the work she does getting those together and getting the packets out to the board.
I'm going to go ahead and mute
we really
everybody.
appreciate it. So the minutes were sent out to you. I hope you.
Okay, problem solved. If you need to unmute for some reason, remember it's *6. Thank you.
All right, Mr. Sykes, it seems like it's repeating. I mean, it's like repeating what we're saying. Do you know why that is?
Yeah, it's because someone's on via the phone and they're hearing their live audio via the receiver on the phone, and then they're also watching on another device the actual live stream, which is delayed 20 seconds. So that's why.
All right, so they need to mute their devices.
Exactly. That'll solve the problem.
All right, thank you. All right, so there's a motion by Judge Lazara to approve the minutes as drafted by Ms. Carroll. Is there a second?
I'll second.
All right, Ms. Moss, any discussion, questions? All those in favor?
Aye.
Aye.
Any opposed? All right, the minutes are approved. All right, so we'll just move to old business. So the first item that I have on there is resuming in-person meetings. And so I'm hoping that we might be able to do it in January, but I'd like to hear what the board members think about that. If there's any, I mean, I look at the numbers pretty much every day. So, but most things are back in operation, and I do believe that we could meet in person safely. We may have to wear masks, but I do believe that we could do it. So I think we should shoot for January, but I'd like to hear what the board thinks.
I have no issues with meeting in person. So
Judge Lazara, what about you?
I mean, January sounds reasonable. I mean, you know, we finish out the year online and then start the new year in a new way.
All right. Ms. Klein?
I agree.
All right. Ms. Hallam, are you still there? I don't see her anymore.
I mean, you all know where I stand on this. I thought we had made an agreement earlier that we weren't going to resume until the folks who are incarcerated had the opportunity for their families to visit them. That is still not in place. So, I mean, I'd just like to stick with what we had agreed upon previously, and that's all I have.
Was there a motion to that effect? I know that was part of the discussion, and that was what you had indicated, but I don't know that, I don't remember whether we may have voted on that. Does anybody remember? I could go back and look in the minutes and we could get to confirm that, but.
Yeah, I would just like to get an update on when they're expecting that to happen. And if visits are planned to resume in January, then I am very comfortable with us resuming our meetings in January as well.
All right. I'm not sure why one has to be affected by the other. There are very different reasons why in the corrections facility, it might not be safe to resume in-person visits, whereas having the board convene in person might be appropriate, but we'll get an update on that. Ms. Moss.
Well, I'm okay with going back in January.
Ms. Wagner, though I guess you won't be on the board, but I still want to hear your opinion.
Sure. So one of the considerations that I've always believed important for this is the availability of the vaccination for young kids, even though I won't be on the board at that point, but that's also a consideration for my office. So I would agree, now that that's available, that is fair for the board in January. But I would also say I do agree with Ms. Hallam, and you know, I don't disagree with you, Judge Clark, in that they're two different things and two different considerations, but I would like to have an update from the jail on a resumption of visits, and I think alongside that is probably giving us some explanation of what they're anticipating with the vaccine deadline on December 1.
All right, thank you. And then we'll ask for that. I think that is on the agenda. All right, so we have pretty much, did I miss any board members? All right, thank you. All right, so next on the agenda is a report from the IIWF committee. Judge Lazara.
Hello, everyone. There were two things listed on the agenda for us, the survey and the liaison position. I can tell you that the committee has been working to get the liaison position moving forward. That's been what we worked on more this month than anything. We have some things in the works, but we are still undertaking a little bit of study to figure out how best to move that forward. And I actually just sent my committee members an email asking them to respond for some dates for another meeting that we need to have with an interested party. So if you guys would get back to me, I'd appreciate that. So that is moving forward, and we're hoping to have a lot of good information for you for the December meeting, but we think we need a little bit more time to firm some things up. In terms of the survey, I'm really sorry, but we have not talked about that. So I'm going to ask if Brad and Terry have some additional information about where the survey is.
So Ms. Klein has her hand up, so we'll acknowledge her. Ms. Klein. You just mute. Oh, there, you muted yourself though.
All right, can you hear me?
Yes.
Perfect. So this is from Dean Farmer. She is halfway through data entry, and yay, there was a signed contract that she received 2 weeks ago. So thank you, people in the county. So she's hired a team to speed up the entry process. So she's expecting to have all data entered by early November, and then start the analysis. And she's reluctant to make any preliminary analysis because she's going pod by pod, and there seems to be a lot of different concerns based on the pod. So looking forward to good information soon.
Kim, you're muted.
Thank you. I think we'd get this down by now. Does anyone have any questions for Ms. Klein or Judge Lucera?
It's such good news. I'm so glad that the contract is done and that they're moving forward. I can't wait to see the results and can't wait to report on our liaison results, hopefully next month.
That would be great. Mr. Korinsky, is there anything you want to add?
No, Judge Clark, thank you for asking, but I have the same information Ms. Klein does, so.
All right, thank you.
Thank you.
All right, well, that's a very good report, and I appreciate all the work that your committee has done. I know how hard you're working. I know what a hard worker Judge Lucera is, so I know she's cracking that whip a little bit, but that's okay. It's important. Thank you. All right, so next we're going to have any updates from the Suicide Prevention Subcommittee, really just an update on the status of recommendations from the report, if any, by Warden Harper, and an update regarding reinspection of the completed recommendations.
Well, as far as the recommendations, we haven't met yet. We have to meet with the warden and find out, because I'm not sure who, because Barb Paris was in charge of the committee, right?
Yeah.
Okay, well, we have to get together to meet. We've talked about it, but we'll have to meet with the warden so we can find out regarding the reinspection of the work that has already been done.
Thank you. Warden, do you have any updates on the status of any recommendations? Has there been any new things that have happened since our last meeting?
Good afternoon, Jail Oversight Board and Judge Clark. I'd just like to report to the Jail Oversight Board that our facilities maintenance team is working in our facility to remove plumbing, toilet fixtures, and bunks out of 7 cells designated on our pods to install our padded cells. So we're working on that now, and hopefully the installation of the padded cells will begin sometime next week. That's all I have to report pertaining to the NCCAC report.
All right. Does anyone have any questions for Warden Harper? All right, thank you.
Judge Clark, excuse me, could you tell me who's on the Suicide Prevention Committee?
I don't remember off the top of my head. I would have to go back and look. I know originally it was Ms. Paris, and I think was there anyone else? I think it was.
I thought that myself and Bethany were on it, and maybe even Chelsea, because there was a lot of overlap, I think, between the two.
Right.
No, they weren't. It was one other person, but I don't believe that. I don't think Chelsea was on. See, because we never really met as a group.
Well, we had a meeting, we had a Teams meeting over the summer, I remember, where we went through all of the recommendations and where it was. But
Right.
I think that may have been the only meeting we had. Because I
Right.
think after
Because
that, it was
that's the
just a
only-
matter of getting the reports.
Yeah,
Mhm.
I think that was, I mean, initially there was a couple of reports, and then the recommendation was that at each meeting, the warden would provide us with an update on the progress.
Right.
But I think
Right.
at the last meeting, there was a raise, and that's why this is on the agenda, about who comes back and then does the inspection to make sure that once all of the things are done, who comes back and says all of the
Right.
things done. So that, I
Right.
think.
That was the last thing we spoke about, and
Right.
I'm not sure. Yes.
And so,
Okay.
do you know, so look, once all your things are complete, will someone come back and review the changes and the improvements and say, yes, you did them, or no, you didn't?
Your Honor, we was not planning on doing that. We have the experts we feel in our facility that can provide that recommendation. So no, we were not planning on doing that, ma'am.
Okay, thank you. I guess the board could come and look, and you could give us a tour if we wanted to do it that way at some point.
Yes, ma'am. If that's what you recommend, yes, ma'am.
What does the board think? Or is there something else that you'd like to see happen with regard to the improvements? Well, let's think about it. I mean, I think it might be good, like, once everything is completed. I mean, there's still a lot of things in progress, like the padded cells are being done. It might be nice, once the warden says that everything's complete, that we go and we look. We have the report, we can see what the issues were, and then we can see what has changed. I think that might be a good start.
Okay.
Anything else? All right, Warden, can we have an update on the policy for Polycom devices?
I'm proud to announce that the policy for the Polycom devices is complete. We have the scheduling up and running for the Polycom machines. The only issue now, Your Honor, is we're working on verbiage to put on the website so the professional visitors will know how to schedule the visit. So I will have that up and running within the next week, ma'am.
All right, great. Does anyone have any questions for Warden Harper?
No, I mean, that's so wonderful, because that really has been a concern about trying to get people out to programs with the inability for them to talk to, to be assessed by those programs. I'm quite sure, Warden, if you work with some folks from JRS, and if you need who, I can certainly get you who, because JRS does a lot of the work with the other providers. So that could be a way to get the word to them about how to do the scheduling.
Yes, ma'am, we can do that.
Great. All right, any other questions or comments? All right, thank you. Warden, can we have, so this has already been mentioned and it is on the agenda, any updates on a plan to resume visitations in the jail?
You know, Your Honor, one of the things that we do at the Allegheny County Jails, we monitor the COVID cases in our community. And if you look at the COVID cases in our community, you still see that it is kind of high. And with us having the approval to vaccinate children, we would really like to get data about the vaccination of the children before we start resuming visitation into our jail. So right now, that's what we would like to do. And then we'll make a determination later after we review, the data for the children being vaccinated.
Do you sort of have in the back of your mind, like a target date where you would like to see visitations in the jail resume in any form? It could be that you might decide that you don't want children right now because of that, but other family members may be able to visit, or so do you have any kind of target date in your mind? And I guess the other thing is, have you sought any, guidance from the health department in how you could safely resume any form of visitations in the jail?
Jan, the target date is as soon as possible. As soon as we can see that these COVID cases in the community is reduced and it's kept at a steady reduction for a while, I would definitely talk to the health care department to see if it's safe to resume visitation. But I'll talk to the healthcare department and maybe they can give me some guidance as to, you know, what the numbers should be when we start visitation back at the jail. So I will talk to the health department about that.
Because what I'm thinking, Warden, is that there are some things that you might be able to say, we're not going to resume at full force, but you might want to say, for example, if the resident in the jail and the person visiting are both fully vaccinated, that it might be appropriate for a visitation to take place. So they would have to show proof of vaccination. You know which residents of the jail are vaccinated. So you could start small, which I think would be a good idea since it's been so long, to kind of do it incrementally. And in my mind, at least making sense to me, I'm not a health expert, so there's a disclaimer on that. But it seems if you had a resident in the jail that was fully vaccinated, and then the person coming in that's requesting the visit was fully vaccinated and showed proof, then maybe you could start there. That's just a suggestion, and maybe that's something you could talk to the health department about. Ms. Howard.
I think that's a great suggestion, Your Honor. So that's something I'll talk to the healthcare department and my team about. So I'll definitely look into that, ma'am.
Ms. Howard.
Yeah, thank you so much. So I just want to know, first thing, I do know that the state DOC, that's actually what their policy is right now, is that only incarcerated folks who are vaccinated are allowed to have their family members come and visit. I don't know if that also applies to the people coming to visit them, but I do know that. So maybe Warden Harper could reach out to them. And also, York County has reopened visitation, Lancaster County, Dauphin County, a lot of comparably sized county jails throughout the Commonwealth have re-implemented visits as far back as like August. And so maybe if Warden Harper and your team would be willing to reach out to them to figure out what it is that they have done to be able to do it, just so that we can get those back up and running as soon as possible.
We have spoken to a lot of the different agencies, and you're correct about the PADOC that they had been allowing more broad visits, but then with the presence of variants, they scaled those back to only their vaccinated population, and family members needed to provide proof as well. Any others were doing non-contact visits. I think the hard thing is that jails can be of similar size, but setup is significantly different. So there are a number of different things that we have to evaluate to make sure that we can safely manage this. Though children getting vaccinated is one part, it's very important. We also have a number of different organizations that are supporting that employees need to be vaccinated. The federal government just announced that any healthcare provider that receives or provides patient care for Medicare patients, all of those employees must be vaccinated by January 4th. So the nice thing is that we believe in Allegheny County at large, the vaccination rates will improve, infection rates will decrease, and that the same will be reflected within our population. So our hope is as soon as possible, and it's very contingent on what the recommendations will be.
Can I ask you about that? So if that's something that you're making these decisions contingent upon, what if just the possibility, I mean, the majority of visits at the ACJ are non-contact visits, correct? Is that still the case?
Yes.
If there's a very physical barrier between the incarcerated people and the folks coming in to visit, I assume masks can still be required and all that. I'm just wondering, what specifically are we waiting to change? Because really, if an incarcerated person has COVID even, or a loved one has COVID, and they're separated between 4 feet and 2 panes of glass, what really is it that we're waiting for to change?
Well, you got to realize that these individuals coming into our facility pass employees when they come in. So therefore, that virus could be passed on to the employees who work on the different pods when they don't work visiting checkpoints. So that's the issue.
And I think too, we recognize that, as a public health measure, we are a facility where those visitors will have close contact with each other. and they are going to be riding elevators with each other. So enclosed spaces where they cannot socially distance. And even though we require masks, you know, as I'm speaking, I have to continue to adjust my mask to be up as well. So these aren't ideal answers, and we recognize that. I think we all want this to be over. We desperately want it to be over, but we have to recognize that we as an institution stand for the safety of all, and that includes those that visit our institution as well.
Okay, and to clarify, that deadline's coming up soon that all of your staff have to be vaccinated, correct?
Correct.
Okay.
Any other comments or questions for Warden Harper or Chief Williams? All right, so we look forward to hearing more at the December meeting about this. All right. The next item of old business is an update on the plan for compliance with the solitary confinement ban ballot referendum. Warden Harper.
So we're still moving forward to ensure that we're in compliance to the referendum chapter 205. But as you guys know, December the 1st, there could be some issues. So right now we're on track on being in compliance, but December the 1st could change some things up.
And so there have been some trainings that have been going on. Is that correct, Warden Harper?
Not yet, ma'am. So I was going to report on the trainings that's going to be taking place in the future during the warden's report.
Okay, we'll leave that for that. And so can we just segue then to the next thing about the review of the cell extraction policy?
So one of the things I want to report to the board is that in October, we had 4 uses of chemical agents in October. After December the 5th, we will not be able to utilize chemical agent. So therefore, a cell extraction team will have to be utilized to extract these individuals from the cells. So I'm just want the board to just be mindful when more inmates and more officers are hurt, it's because we cannot utilize chemical agent after December the 5th.
Thank you. Any questions?
I'm sorry, Judge Clark, I have a question about that. Is the warden telling us that because they cannot use chemical agents that people are going to be hurt? Is that what he's saying right now, or did I misinterpret that?
Saying, and I think we heard when we had the meeting with Seesaw and the information that I got from then Secretary Wetzel is that without the ability to use pepper spray and shackles in a cell extraction, I can tell you Secretary Wetzel basically said he can guarantee more people will be injured because it's a volatile situation. And so if they can't get someone to de-escalate with words and they have to go in and they don't have the sort of the less lethal types of methods to extract or to stop someone, more people, because if you can't shackle, people can be kicked. If you can't spray, I mean, the thing is they're going to have to send a team of people in to physically take someone out of a cell if that person is a danger to himself or others. And so that's what they're going to have to do. I think that's what the warden is saying. That
I just very much did not appreciate the way that was said. It came across as a threat. My question, I guess, is
I think that's not a fair. Everybody else is shaking their head no, so I don't think
it came across to me as a threat, and I did not appreciate that. But then I will move to my question. How long was the jail using chemical agents?
Ever since it was built.
Since the day the jail was built, and what year was that?
1995.
So prior to 1995, the jail got along just fine without it?
I can't speak to what happened before 1995, Ms. Howell. Best practices in the correctional industry, and if you talk to any correctional professional, OC is utilized to try to quell the disturbance before the use of force. That's best practices, and that's been taken from us.
And do you have any data on injuries due to the removal of chemical agents? I would like to see that if we're going to state that and use that as the basis for why there are issues complying with a referendum that was passed by the voters of this county.
Well, I don't have data, Ms. Howland, but it's just, basic knowledge that if we can't use the OC spray and we have to go and get individuals, people are going to get hurt.
I think that was the statement of, I'm sorry, can't remember his name, Mr. Korinsky, the expert that testified. What was his name?
That was Mr. Rainey, Judge.
Yes, Mr.
And he
Rainey.
was talking about I think he was talking about the use of the restraint chair to move people with that, but that was Mr. Rainey.
He also mentioned the pepper spray and the shackles, and that was also the information that I got from Secretary Wetzel, which I provided to the board. So I think that's the issue, and there probably is not going to be any data, at least with the jail, until after they can't use them. But there might be data somewhere else. I don't know, but. Does someone else have a comment or a question? Yes, Ms. Klein.
Would there be consideration to have a subject matter expert on tasers, because that is something that will still be available to use?
Ms. Klein, we already have tasers and our staff is already trained in the use of tasers, but tasers cannot go around mattresses. Tasers cannot go through doors. So tasers is effective somewhat, but it's not effective all of the time.
I guess my question was if there would be any additional training by someone out there that, given the restrictions from the referendum, that might have suggestions for taser use, but perhaps that's not possible.
Is she waiting for?
Was that a question?
Was that a question for us?
It was just a question about if there would be possible to get any additional training given the constraints of the referendum that might make tasers a better, an option, maybe in a new way, but.
Ms. Klein, we already have taser certified instructors here at our facility that has received the course. So we have the expertise here that's already trained, and we're still going to run into that dilemma when an individual that's incarcerated in our facility put that mattress up against the door. You know what I'm saying? Our taser is not going to go through a mattress. So no matter what other trainings we get, that's just not going to be effective.
Okay, I understand.
I don't know where Judge Clark went, so I'm going to ask another question while we're waiting. So I hear a lot of discussion about like the limits of the referendum, and I understand that those exist. I do believe that they were intentional. That's why the referendum was drafted the way that it was. But what I mostly want to hear about is like actually what steps are being taken to be prepared for this December 1st deadline, right? Is there a plan to inform the incarcerated people of these new policies? Is there a way to give them a way to report any violations of the referendum ban? What exactly is the jail doing to prepare for this? I understand that there are obstacles and you go over the obstacles multiple times, but can you go over exactly what you have done to prepare for the referendum's implementation and, what it's going to look like on December 1st?
I'm not going to get into everything that we're doing to prepare for the referendum, Ms. Howland, because that's going to violate some safety issues at our facility. But what I will say is this. We are preparing to train more correctional officers to do cell extraction. We have not put out to the inmate population as to what can be done and what will not be done. And we will not do that because I feel as though that if they know that, then that could cause more issues after December the 5th. So I don't know what else you would like for me to report on.
I would like to know, after the previous contract was ended, what new steps you have taken to be sure that you're able to comply? I understand you're doing cell extractions, trainings. What do those look like? Who is conducting them? Who is receiving the training? Is that all that you're doing to prepare for this? Do you have also all the administrative aspects in place for the reporting requirements as well?
We have all of the administrative processes in place for the reporting, but of course that's changing, quite frequently. As I stated, we're preparing to train more correction officers in cell extraction, and we have certified correction officers here that can teach that training, man.
Okay, but what about specifically about the solitary confinement aspect of it, about that being banned? Do you have procedures in place to let the incarcerated people know? I don't see how that could be a security concern, to let them know that they are not permitted to be held in their cells and exceed a certain amount of hours a day without a certain amount of rec time, those sort of things. Is there a way to let them know, and will there be a reporting mechanism if they believe that the referendum's requirements for a solitary ban, to understand their rights?
So the incarcerated individuals have multiple ways in which they can report any violation. So they have the electronic tablets where they can do the request, the paper complaints. So they have the reporting system. I'm sure that they already know that they can, after December the 5th, that segregated individuals must be provided more than 4 hours of out of cell time. So I know they already know that already. So I don't have to do that announcement because they know. Secondly, the last thing I want to say is we are getting prepared by building more recreational areas so we can provide incarcerated individuals more out of cell time. So I think that we will be ready on December the 5th.
Okay, and specifically about the appeals process, there is an appeals process that was written into the referendum for anyone appealing I don't want to call it a sentence or a punishment of solitary confinement despite the ban. What is the process that you've implemented for the appeals process?
I have not yet.
Okay, and do you have a plan to build that process?
We will look into that.
Okay, but I just want to clarify that you understand that that is a requirement of the referendum.
I hear you're saying that. I will read the referendum again to ensure, and if that is what the referendum says, we will comply.
Great, thank you.
Okay, so if I don't know where Kim went either, so I'm going to sort of take over till she comes back.
Yeah, can you hear me?
Oh, we can hear you now.
Yeah, but I got kicked off. I guess there's an internet issue here in my office, so I'm trying to get back on it. So I'm on the phone. But if you could, Judge Lazara, because I can't see if people, raise their hand or anything. So if you could move on until at least I can get back in.
Yeah, I figured there were no other questions. I was going to ask if anyone else had any other questions for Warden Harper on the issue of the cell extraction and complying with the referendum. And if no one does, then we're going to move on to the next, which is the COVID vaccination statistics for correctional officers and staff, and that issue.
So I can provide the full vaccination or just state what Ms. Hallam had requested last meeting was those that have direct contact, how many remain without proof of vaccination. That number is 174 out of 609 employees. I am including in that number people who have not completed but may be in their vaccination series because at this time I can't count them as having completed yet and need to act as if they are not in compliance with that order at this time.
Any questions with regard to that? Oh, we have Kim back. Okay. Ms. Hallam.
Yeah, so that's the direct contact number. I very much appreciate you getting that number for us today. Can you also give us just the total number of fully vaccinated versus total employees at the jail? Because I believe even folks without direct contact are required to be vaccinated.
Yes, so all county employees are required to demonstrate proof of vaccination. Our total county employed is 609 in the institution. 388 or 64% have demonstrated proof of full vaccination. We have 211 with no proof of any vaccination or even starting, and 10 that are currently in process. So the 211 is reduced to 174 for the direct contact.
Okay, and is there a plan operating under an assumption that there's that many people that may not have a vaccine come 1 month from today? What is the jail's plan?
Okay, we do have a plan. I'm not going to discuss that plan in this setting, but we do have a plan.
Okay, can we hear general statements about the plan? This is the Jail Oversight Board. I do think it's pertinent that we have the plan for a mass exodus of jail staff members. I think it's
And Ms.
important.
Hallam, I'm not going to jeopardize the safety of this facility. If the board wants to talk to me one-on-one, we can talk, but I'm not going to do it in this setting.
Can we, Warden, can we do it after this meeting in an executive session?
Absolutely, we can.
All right, we'll do that then. Thank you. Any other questions, comments? Yes. Is that Ms. Wagner?
Yes, thank you. Just a quick question on that. Typically with other types of meetings, those are the types of things that we could handle. Can be just 10 minutes of executive session so that what our employee matters in this situation aren't being discussed publicly. Is that something that we could do?
Yeah, that's Kim had already said that. We're going to do that right after this session.
After the meeting,
Okay.
we'll go to executive session.
The mute function when you're on the phone, it speaks over and it says you're coming off of mute, so you don't hear things for about 5 to 10 seconds. So I apologize.
That's
Thank
okay,
you.
no problem. Any other questions concerning that?
I guess my only other question would be any other, in addition to the COVID plan, in case anyone doesn't comply with the vaccine mandate, what percentage of staff vacancies exist prior to that? Are we already operating on a low staff count in regards, especially to the folks that have direct contact with incarcerated folks?
That's something that I would like to discuss in the executive session, Ms. Howland.
Cool. All right.
All right. Anything else? All right. Thank you. So we will move to public comments. We had a number of public comments. Many of them dealt with conditions in the jail. So I'm going to start with those comments. Phil Wiggins says, I heard over the weekend that people housed on 8D went on a hunger strike, and in response, ACJ took away their tablets. During that time, people could not file sick call requests or grievances, which could only be done using the tablet. Can the Jail Oversight Board require the Allegheny County Jail to provide hard copies of these forms so that people who are denied access to their tablets can still receive medical attention and be able to exhaust their administrative remedies? Also, the tablet does not allow an individual to keep copies of the sick calls or grievances filed, which can prevent someone from pursuing various forms of legal and medical relief. Can ACJ allow individuals to retain an electronic copy of these essential documents that they file on the tablet?
The response to this is that over the weekend, 8 Delta was extraordinarily unhappy, and they utilized their right to refuse meals. That ended before a 24-hour period had elapsed. The allegation that they were not able to file any sick call requests or grievances is false. We have paper copies of those, and in fact, the sick call process is a paper process. Some of the incarcerated individuals utilize a section within the tablets that's called medical complaints for sick call, but that was truly designed for the grievance process for healthcare needs. Sick call has been and will continue to be until the interface is established, a paper process. Additionally, all of the requests that are submitted throughout the tablet, they do not disappear. So there is an electronic record of those at all times that is associated with the individual's account, even when they are no longer active in the institution. So if those were needed, those could be provided at any given time.
Thank you. Ms. Hallam?
Yeah, I just have a question, because with the paper grievance process, they were able to retain those records for themselves whenever they file any sort of grievance or sick call. And in my understanding from what you're saying is that now with the tablets, they have to formally request those? Is there a way that they can automatically receive those records since you're saying that they exist anyways? What is preventing you from giving them those records anyways?
So they exist in electronic form, so they can access what they've submitted and the responses at any time through the tablet while they are incarcerated. They can make a request for those, just like if they were to make a request for their healthcare record. So their healthcare record is an electronic format as well. They submit for that in writing, and they sign a receipt as having received those records. So we don't just, as a standard practice, print. That would be an enormous waste of paper and a detriment to the environment. But if that was required, then that can be provided.
Okay, thank you.
Any other questions? Our next comment is from Sam Roberts. Mr. Roberts says, what progress has ACJ made in renegotiating the commissary prices with Summit so that individuals are not charged exorbitant prices for hygienic and sanitary items which are necessary to prevent the spread of COVID?
Yeah, and I think we took care of this months ago. You know, we came up and we discussed with Summit. The Summit prices are final as of this time, and we will not be able to renegotiate the prices until the next contract.
So are they different than what was reported at a few meetings ago? I know that Mr. Korinsky had done a report on the prices and did some comparison with prices other places. Are those the same prices, or have they changed any? Because there was some concern about some of the prices being really high.
And you're right, Your Honor, and those prices are still in effect, and we're not going to be able to change those prices until the next contract.
Can maybe between now and the next meeting, I'm not sure that that's accurate, but because I think there are some legal issues with the prices, could you check with the solicitor and see if anything can be done before the next contract so that at least the prices are in compliance with the law?
I could do that, Your Honor.
All right. And so then we'll get a report on that at the next meeting. All right. Our next comment is from Richard Jones. Mr. Jones says ACJ requires incarcerated people, including those who are indigent, to buy Tylenol, Motrin, and other basic over-the-counter medicines instead of providing it for free. But because these meds are so expensive, many who are prescribed to take them daily cannot afford them, even with the money allotted for commissary. Many incarcerated people are forced to choose whether to use their limited funds to talk to their family on the tablet or suffer in pain. How does the jail decide which medicines to charge for? Can the Jail Oversight Board require the jail to provide these medicines for free to the people prescribed it? So
I want to respond to this if I can. We do have over-the-counter medications available on commissary. That's not new. That has always been in existence despite the new vendor for commissary. However, some people in the facility are prescribed these medications. So we provide for free anything that is deemed to be of medical necessity. Things that are not deemed to be of medical necessity, that is made by the practitioner's determination, and then the inmate or incarcerated individual could be redirected to purchase those items from commissary. So we have a number of individuals who may be used to taking NSAIDs like Tylenol or ibuprofen, but those are really to be prescribed for short term. In length of time or long time taking those, you can have other medical conditions that might result. So this is left up to the practitioner's determination. Items that are medically necessary or services that are medically necessary are provided at no charge with no copay to the incarcerated individual during the length of their stay.
thank you. Next, Sylvia Williams says currently the jail is consolidating housing pods in response to staffing shortages. For example, 8D, which is a maximum pod, is being combined with 4C, an intake pod. This is dangerous because increasing the pod's population prevents incarcerated people from being able to socially distance safely. It also is dangerous because it mixes people of different classification levels, meaning a person charged with first-degree murder is on the same pod as people charged with much less serious offenses. Are there other options available to address the staffing shortages that doesn't risk the lives of incarcerated individuals and staff?
So a lot of this comment is inaccurate. You know, our classification procedures and the management of the population meet all safety guidelines. So we feel as though that we're meeting all of the safety guidelines when it comes to managing the population at our jail.
Ms. Hallam?
Yes, so going off of that comment, are pods being consolidated right now?
Pods are being collapsed, and we're collapsing pods based on classification and best practices. So yes.
Okay, and are each folks on the pods, especially now that they're being collapsed, is anyone on the same pod as someone with a different classification as them?
I'm just going to say this because I'm not going to get into that in this forum. We follow all of our classification procedures, Ms. Howell.
Okay, and why are pods being collapsed right now?
I'm not going to get into that in this forum, Ms. Howell. We can talk about that later.
Okay, why not?
The management of the population is our prerogative. That is something that we have discussed. And I think the warden has said on more than one occasion that it's not appropriate to discuss in this forum, and it will not be. So the response isn't going to change no matter how many times you ask.
Okay, well, I will ask a different question then. I'm wondering if during COVID, when it's obviously too dangerous to even have visitors come in, why we are condensing and collapsing pods and putting more incarcerated people on each pod.
Ms. Hallam, again, we can discuss that during the executive session.
All right, thank you. The next comment comes from concerned resident. Awesome to see members of the Oversight Board doing jail inspections. I know photography is typically not allowed inside the jail because of safety concerns, but I was wondering if board members might be able to take some pictures or video recordings. Since we talk so much about food service, for example, it would be great if board members could take photos of food trays when they eat at the jail. So, I mean, I think the answer to this is sort of obvious, but I will ask the warden to address the reason why we can't take photos.
I don't think that the board members would need to take photos because when you guys did your unannounced visits, you actually sat and ate the food, you know what I'm saying, when you came into our facility. So why would you need to take photographs when you actually observe the wonderful meals?
I think with the resident, the person who's writing, then maybe they could be shared with the public. I don't feel like I need to take any photos because I was there, I saw whatever I saw. But I think the idea is that the public wants to see, I guess, what we saw on our visit. So
I would just say, Your Honor, is that hopefully that the citizens would trust our board members to report the wonderful meals that's being served at our jail. And I think on the inspections that took place, you guys observed the meals that was being served.
Right. I think they were talking more, not just about food service. That was one example. So I guess the question is there a safety concern if board members were to take photos during their inspections of the jail? I guess that's the question.
Yes, ma'am. I think that would be a safety concern.
I would think so. I wouldn't have thought to ask it, but somebody asked it. That's why I'm raising it. All right. Thank you, Warden. The next comment is from Mr. Kensowitz, who says, since April 2020, 10 people have died who have been incarcerated at the jail. And he names them all. Well, he doesn't name them all. Cody Still, Justin Brady, Vinkley Harris, and John Brady all died after being at the jail for only a short period of time. ACJ has the responsibility to provide emergency care when someone walks through the doors of the jail. In addition, police, paramedics, and the courts also have a responsibility for the well-being of individuals before they arrive at the jail. These deaths were very possibly preventable. I am asking the county executive and the jail oversight board to form a task force of subject matter experts in the field of law enforcement, emergency medical services, opioid and mental health services and county jail administration to develop best practices for these instances. So I don't know whether you want to, well, I'm going to ask Warden if you have any response for that. I would say that there are some things that are happening, including the RFP for the jail redesign project that would possibly cover some of these things. And also, I think Ms. Dalton has given some other presentations on sort of crisis response and things like that, which would help as well. But I don't know if you want to say anything. And then I can ask the board whether they want to do anything in response to Mr. Kensewitz's questions or a comment.
Yeah.
It's really not a question, it's a comment.
Your Honor, I don't have a response for this.
All right.
I don't.
All right. So Mr. Kensowitz, I'm sure you're listening. So maybe we could talk and you could tell me exactly what you might like to see happen. I could set up a call, or if you could email me in the next couple of days, and maybe the two of us can at least start by chatting. How about that? All right. The next comment that I'm going to present is from Ronald Johnson. What challenges does ACJ expect to encounter from the staffing shortages in the healthcare and corrections departments in the months ahead? Can the State Department of Corrections or other correctional facility temporarily assign their corrections officers to the jail to make up for staffing shortages? Can the county assign more healthcare providers to the jail?
So in general, I think that we've said on a couple of occasions in this meeting alone that we won't be discussing, the staffing shortages. What I can say is that we are not the only agency complying with mandates as such as we have upcoming, and that there are nationwide shortages and have been in the healthcare field, as well as in the field of corrections. We will lean on our partners for additional ideas and support, but I doubt that they'll have the resources available to lend additional staff to our institution.
And I guess some of these things we will be discussing in the executive session. So thank you, Chief Williams. Ms. Howland.
Yeah, just speaking of, you mentioned healthcare staffing. Do you have a breakdown of the unvaccinated staff members that work in the healthcare field in the jail?
I do. They were included in the direct contact numbers as well.
Okay, yeah. How many of them are in that 174 direct contact? How many of those are healthcare workers?
4.
4. Okay, thank you very much.
All right. So there are some comments also about sort of some restrictions and lockdown. I guess this one is not really, it's sort of in that category, but I'm going to read it from Janelle Cornyn. At the October meeting, Mr. Pilarski said that fruit is not allowed at the jail because it can be used as a weapon. Can the jail explains that? It sounds a bit strange to civilians.
So an apple could be used to be thrown at an individual. And then also apples and fruits can be cut up to make homemade wine. And of course, we don't want incarcerated individuals to be under the influence while they're in the jail. So we don't want hard apples or whole apples to be utilized as a weapon or thrown at individuals to cause injury to staff and to inmates.
Thank you. The next comment comes from Chris Jacobs. One of my friends recently lost tablet privileges for almost a month. For that whole time, he was listed as suspended on the Getting Out app because he wasn't allowed to send or receive any messages. Because his account was suspended, I couldn't contact him at all and was really worried about his mental and physical well-being. I thought that everyone in the jail was supposed to have access to the tablets. Why would someone's account be suspended?
So if an incarcerated individual violates our rules and regulations, we do take their privileges from them. But when the privileges are taken and they can't make phone calls and everything, they're still provided a tablet so they can do law library services. So apparently that individual must have violated rules and regulations.
So I guess the one question is though, how I guess what's sort of in the comment, it's not the specific question. Then if a family member is concerned about that person, how would they then try to contact or find out about that person if the tablet privileges are suspended.
Then that I would advise that they email us. We have an email that they can send to us, or they can call.
All right, thank you. Rachel DeWitt says, one of my friends just got transferred from ACJ to a jail in Ohio, and he says that at the new facility, they're allowed out of their cells every day from 7 a.m. to 10 p.m. I understand that every industry has struggled to adapt to COVID, but it seems like the Allegheny County Jail is having a much harder time than other jails. Why is ACJ still on 23-1? Why has it been locked down this entire time?
Your Honor, our primary responsibility is to make sure that that virus don't spread in our jail. Now that our numbers are down, we're going to look at, allowing more individuals to come out so that they can get more out of cell time. But our primary responsibility is to stop that virus from spread.
Thank you. Rachel DeWitt, no, I just read that one, I'm sorry. Malcolm Durridge says, in a recent interview, Susan McCampbell of the Center for Innovative Public Policies says that she wasn't aware of any jail in the whole country. I guess this is sort of the same thing, but I'll read it just because it is sort of the same question. In any jail in the whole country that has been operating as restrictively as ACJ throughout the pandemic. In PA, most detention facilities are no longer in lockdown, and York, Lancaster, and Dauphin County jails are again allowing in-person visits again. The entire country has a hard time dealing with COVID and with staffing shortages, but only ACJ has been on 23-1 lockdown for the entire pandemic. Why does ACJ have this problem? So we already really kind of had this discussion based upon the last question, and you also talked about the in-person visits. Ms. Hallam, did you want to say something?
Yeah, I just wanted to read, citing the same person who the person from the public commenter cited. That quote was from Susan McCampbell. She's the president of the Center for Innovative Public Policy, and there was an article where she was quoted. I just wanted to add on it because something else she said I think is very important, and I would like a response to. She said that any facility that has 100% of their incarcerated individuals locked down 23 hours a day, there's something really, really wrong with it. If the COVID epidemic has overcome them, that means that the Allegheny County Jail, has very poor health care. There are issues with incarcerated folks' supervision, staff hiring, and staff training. So has the jail done anything differently since the lockdown started in regards to staff hiring, staff training, or healthcare at the jail to try to stop this lockdown from happening? Because it truly does seem, based off my research, based off talking to experts in the field, that Allegheny County Jail truly is an outlier in this situation.
So to directly address the hiring conditions, we were one of the facilities, I don't know of any others that have been able to do this, but last year, during the pandemic, we had support to dramatically increase rates so that we could further recruit for additional staff. We're competing with a lot of different healthcare entities in the Pittsburgh area, as you guys are well aware. Our LPNs, for example, went from $18 an hour to $28 an hour. Our RNs went from $26 an hour to $34 an hour. Having competitive pay rates has been something that has very much limited us in the past, but has allowed us to bring on additional staff throughout. I think that it's very convenient for somebody who's not seen our setting to make such blatant comments about the healthcare department. I'm devastated that anybody would just so willingly say things that are totally disrespectful to the hardworking people who have been in this institution fighting during a pandemic, during staffing shortages, but everybody's entitled to their opinion. I just want to focus on that as an opinion of a person and not fact. I would also state that it's important to remember that our case counts, though they have definitely at times been higher than they were in the early months of the pandemic, as an institution, we have had some of the lowest case counts despite having thousands of people come in and out of our facility. So our COVID mitigation measures have been effective for the population, and we do have an obligation to keep them safe. We have struggled with vaccination rates, which I will be providing those numbers. Despite continuous vaccination, we can't meet 50% because of the transient nature of our population. So I think it's easy to look at numbers. I think it's easy to just say jails this, prisons that, but it is not indicative of what is actually going on in this institution. And I feel like every single employee here would expect the respect and dignity to understand that they are working very hard.
And I just want to piggyback off the chief, because I was just reading a newspaper article today where one of the county jails had 21 deaths during the pandemic, and 5 of the deaths were through homicide, and 5 of the deaths was through suicide. Unfortunately, we had 1 death due to COVID. So I piggyback off the chief. We have done a wonderful job during this pandemic with the measures that we've taken place, because we could be just like this other county jail and have all of these deaths within this 18 months.
I think my question was misinterpreted. It was not directed at all to the healthcare workers at the jail, but instead the administration who is responsible for the policies of the jail. Really, I just want to know if the issues that we're experiencing are ones that, according to you, are being experienced by all other jails in regards to staffing shortages and those kind of things. How come we're the only one who's still on 23-and-1? How come we're the only ones who still aren't having visits? How come we are the outlier in the situation? I understand, again, all of the problems that we're dealing with, but those are not problems that are unique to Allegheny County or the Allegheny County Jail. So why is it that we're in this situation? If you could please just answer that question. What is different?
I'm gonna answer this again, Ms. Howell. We had 1 COVID-related death. Look at other jails our size and how many deaths that they had. It's because of this administration and the employees and what they've done. So that's the answer to your question. What we've done works. It saved lives.
That is not an answer to my question, because I also read the same article that you're referencing about the Philly jail, and I'm wondering why the other jails who also have not had COVID deaths, who also are back resuming visits, who also are done with the 23-and-1.
So, Ms. Hallam, it was an answer to your question. It's just not an answer that you want. And it's okay that we have a disagreement here. We do that frequently.
All right, I think
I'm really holding it all together because I do not appreciate the way that you direct your comments towards me, the way you speak towards me. It is wholly disrespectful, but I'm beyond that because I am here to try to protect the people in this jail, and you're giving workaround answers. It's either we can't answer your questions because of security concerns, or we're just going to say we answered a question that was not answered. It was my question. I did not get a complete answer to the question, and that's all I'm asking for. And I do not think that is too much to ask for. So please watch how you talk to me. I try to give you respect when I ask you questions. I am not getting it in return. I would simply like my question answered. Thank you very much.
All right, so respect works both ways. And so I think we're going to just move along. All right. The next one is Kim Sanders. Warden Harper told the Pittsburgh Post-Gazette that the county jail conducts an internal review of each person who dies in the jail's custody. Can you please describe the internal review process? What is its purpose? What materials or information does the jail rely on in conducting these internal reviews, like looking at autopsy reports, and what else?
Yeah, and I don't think that's appropriate for me to discuss everything that we do to review a death. So if that's something that we can discuss in executive session, I would be more than willing to do.
So, well, I guess one question I have, does the jail even receive the autopsy reports or review them?
We do not receive the autopsy reports, Your Honor. We do receive cause and manner of the death, but we do not get to see further details.
So one other question, is the Allegheny County Police involved in the investigation?
Yes, ma'am.
All right, so there's a police process that happens through the county police.
Yes, ma'am.
Is that for any death that happens in the jail, or does it depend on the type of death?
All deaths.
And so does the count, well, you probably can't answer that, what the county police does with their reports. All right, thank you. The next question comes from Mark Sams. I'd like more details on, well, it's kind of the same thing on the jail's death reporting policy. I thank Deputy Williams for telling us about 6A releases, but was not really clear on when or why the jail might ask for a 6A release. For example, John Brady died at UPMC Mercy last year on November 20th after having a medical emergency at the jail, and his death was not reported to the board. Had a 6A release been requested in his case? Was Mr. Brady still under the legal custody of the jail at the time of his death? What are some examples of times when a 6A release would be appropriate? I think it would also be very helpful if the jail would make its death notification policy available to the public. I think you did talk about the 6A release last time, Chief Williams. So can you just, I think Mr. Sams wants some clarification on that and what that means once the 6A release, even though I do believe this was part of what you stated at the last meeting about whether the person is still in the custody.
Absolutely. So I won't discuss this particular case. I'm not able to. The individual was not incarcerated and can't provide any further detail on that. I can confirm that he had a medical emergency in our institution and was sent for a higher level of care.
I don't think he's asking about specifics about this case. I just think he's asking in general about
He did ask if he was under the custody of the jail at the time of the death. So we,
yes, he did.
So the process is, and we did discuss this last month, we report any death that happens to a person who is in legal custody. That doesn't necessarily mean that they are in physical custody of the institution, but legal custody. So individuals who pass away while they are hospitalized, and we do make report of that. They're still in our legal custody, just not in our institution. So we will and have continued to report any of those circumstances. The 6A release, truly, it's a document. That's how we refer to the legal document that's submitted by the courts, and it's processed through the records department here, and then they go into the release process in the institution. If there's somebody who's not been fully booked, then they are getting released by ROR, non-monetary bond, things like that. There are a number of reasons why we might request the 6A, and I think I discussed this too. There are a number of people who come into incarceration that this is not an appropriate setting for them. So when community resources are limited, or somebody is not engaged at an appropriate level of care in the community, and maybe they have a wellness check at their home because neighbors are concerned about them, and they may get cited or brought to our institution because of terroristic threats. And when they come into our institution, we actually find that they have dementia or Parkinson's or some kind of degenerative cognitive disease. We would, with our social workers on site, work through DHS supports as well as the courts to advocate that that person be redirected to an appropriate level of care so that they can receive treatment. So those are the circumstances in which we would be advocating for somebody to be released. That's certainly not the only example. It does happen very frequently at the jail. We advocate for individuals who do not have to be here to be somewhere else. But ultimately, we are at the court's discretion, and we will continue to follow our legal obligation to hold any remands that are legally designated to our facility.
Thank you. And the last comment that I'm going to present today is from LaShawn Owens. And it's actually a pretty good one, and I hadn't thought about it. And so, Mr. Owens, thank you for this consideration. What is the Oversight Board's plan to ensure that incarcerated people can watch the board meetings and provide public comments? And I hadn't actually thought about that. I think it's something that the board should think about. First of all, I think on their tablets, they could probably access the public comments. Warden, is that correct? If an incarcerated individual wanted to submit a public comment, can they do that on their tablets? Can they access court website and submit?
No, they cannot, ma'am.
Okay. So I would say this, they could submit them, I guess, and is there any way that that could happen, I guess?
I have to check with GTL, see if that's possible, ma'am.
All right. And if not, then I think it would be possible for them to submit just a regular comment in writing, and there would be some way that they could be forwarded to the board. I don't think that that's an issue. I think we can the board should talk about that process. I will say that I do get lots of mail from incarcerated individuals, not specifically for the board, but lots of mail all the time from incarcerated individuals that we do try to respond to, my office. But I do think that's a possibility. Is it a possibility, because we had talked about, even when we go back in person, to continue to live stream the meeting so that more of the public could watch? Is it possible that the live streaming could be available for incarcerated individuals to watch once a month?
I don't know if that's possible. That's going to require internet connections, et cetera, et cetera. I'll talk to my IT team, but I don't know if that's possible, Your Honor.
All right, thank you. But I think that's something that we should think about, and that if we can make that happen. Well, I shouldn't speak for the whole board, but I see heads nodding, so I'm assuming that the ones that are on video, that this is something that the board would be in agreement with. All right, so thank you, LaShawn Owens. That was a great comment. I think it's a good one to end on. So thank you. We're going to move to Warden Harper's report.
Your Honor, I would just like to report that 27 incarcerated individuals voted by absentee ballot. 15 employees will be scheduled for mental health first aid training on November the 9th. 12 employees is scheduled for de-escalation training that will take place on 11/22 and 11/23. And then I'd just like to report, effective October the 26th, the FCC reduced the telephone rates from 19 cents to 16 cents. And that is all I have for the Warden's report.
Does anyone have any questions? Ms. Klein?
Warden, can you tell me, will there be someone on all shifts who have had this special de-escalation training?
I'm really trying to do that, Ms. Klein. I'm really trying.
Appreciate that.
Will this be like sort of a train the trainer? So will these people, will any of the people that are being trained, will they be able to do training internally within the jail?
We have 5 individuals that's going to be certified as trainers for mental health first aid, Your Honor.
All right. And what about the de-escalation?
All 12 of those individuals will be trainer for trainers. Yes, ma'am.
All right. Thank you. Ms. Hallam?
Yeah, the 12 staff members who have been trained, are they of like specific positions in the jail, or they have specific levels in the hierarchy at the jail? Can you just tell us, like, not necessarily their names, who they are, but what their roles are at the jail?
So the 12 employees have not been trained yet, but there are employees from different departments in the jail.
But are they sort of like corrections officers, line staff, supervisory?
They're a combination of everybody: line staff, correctional officers, healthcare staff, everybody.
Thank you. Any other questions?
Yes, yes, I do.
Oh, yes,
This
Ms.
is-
Moss.
And I'm sorry that I can't get on. I couldn't get on Teams at all today, no kind of way. So that's why I'm not on. But I wanted to ask the warden, is it possible to make sure that the people or whoever scheduled for, I guess, the midnight shift, because I'm not sure how your shifts are, that they really be mandatory to have the de-escalating training, because as I talked to the different people that I talked to about de-escalation, they were saying that, especially Torrance, that one of the mistakes they made is that they didn't have that 11 to 7 shifts, or, train, because usually they're the younger employees because everything's done by seniority, and they needed to know how to handle, because it seems that's when most of the things happen in late at night, or you get the most intake of persons who are maybe either coming off of drug high or what have you. So is there a way that you can make sure the people that work those shifts get the training?
Yes, ma'am. Our goal, Ms. Moss, is to have everyone trained in mental health, first aid, and de-escalation, but that's going to take some time.
Well, thank you, but that was just a thought, so you can keep that in mind, because they said that's when they seem to have their most problems.
Yes, ma'am.
Okay, thank you.
Ms. Hallam?
Yeah, I just had one more question. I was thinking, so these 12 staff members who are from all different departments that are about to get trained, I've heard that there's some new team of staff members at the jail called the CRU team. Is that what these people are, these 12 folks that are receiving this training? And if not, what is that CRU team? Is it related to this at all?
The CRU is our correctional response team, and some of those individuals will be receiving mental health, first aid, and de-escalation training.
Okay. Yeah, what is a correctional response team? Like, what are they responsible for? I had never heard of that before recently.
They respond to emergency situations at our jail.
Okay. It's kind of like the CERT team?
Yes, ma'am.
Okay. Thank you.
You're welcome.
Anything else? All right, then we'll move to Chief Williams' report.
Thanks, Your Honor. The jail website has been updated, so I won't provide all of the statistics that are on there. They are comprehensive on the website, and then we also have the month look back. The more important numbers are that we presently have 6 incarcerated individuals who are positive within the facility. Today's institutional count was 1,592, and we have 5 individuals who are pending tests. They are being tested for purposes of transfer, not for concerns related to clinical symptoms. In terms of employees, this again is a comprehensive number. We've had 177 staff from all job classifications, not just one, who have reported positive test results. Presently, we have 3 individuals who are continuing through their recovery process and have not returned to work. As you know, we've been doing vaccinations throughout the institution. We've been holding clinics Monday through Friday for the incarcerated individual population, and to make sure that we're providing an abundance of opportunities for staff to engage in that process, we are providing those clinics as well. We had 2 of those this week alone for employees specifically. We've supported the vaccination of over 1,750 incarcerated individuals. It's becoming a little bit difficult to track now that we're doing booster vaccines. So I'm going to try and get those numbers to be better next month to make sure that I don't have any duplicate counts within those numbers. We still maintain a supply of Pfizer, Moderna, and Janssen. We have 745 individuals, or 47% of our incarcerated population, who is presently fully vaccinated within the institution. And that is a decrease. So last month we had 770, and the month before that we were over 800. So we continue to provide vaccination, but we're not able to maintain a population of vaccinated persons within the institution. We are still complying with the recommendation to provide $25 to the account of all individuals who do elect to receive the vaccination. I've already provided the numbers related to employees for vaccination, but just in case anybody missed those, out of 609 county employees, 388 have provided proof of full vaccination, 10 are in partial vaccination status, and 211 have not provided proof of vaccination, with 174 of those being direct contact. If nobody has any COVID questions, I can move on.
Ms. Hallam, do you have a COVID question?
I do, yes. So are there certain pods that the incarcerated folks who are vaccinated are on? I know that they had reported that they were told that in addition to that $25 per shot that we required them to be given for getting vaccinated, that also they were told that they would get more rep time if they were to get vaccinated. So I'm just wondering how that's being handled.
We, I believe, discussed this last month where we did incentivize and we sent out that notice in the month of June. There was a time period when county case rates were low as well as institutional case rates. And there were a lot of different incentives for individuals who were vaccinated. We had housing units that had the primary vaccination numbers centralized on those units for increased immunity purposes. However, with the variants present, we have found a volume of our vaccinated incarcerated individuals as well as staff members who have continued to test positive. So we scaled back those incentives. We do hope to be able to reintroduce those very soon, but that is not presently going on.
Okay, but are there pods that are fully vaccinated? Like, are they segregated from unvaccinated folks? Is it organized at all like that?
There are no pods that are fully vaccinated right now, but we do have several housing units that are 95% or more.
Okay, thank you.
Any other questions about COVID? All right, thank you. Chief Williams.
Medications for opioid use disorder. So I was hopeful that I was going to be able to provide more specific details related to methadone, but we are still in conversations with the implementation process with that service provider. So next month. In terms of buprenorphine, presently in the facility, we have 43 individuals who are prescribed buprenorphine. From October 1 to October 31, we had 100 unique client individuals who were prescribed buprenorphine. So again, this is a large volume of turnover. So our numbers on the day-to-day do not seem to be high, but we are continuing those treatments for individuals within the institution. We have a commitment from a pharmacy and contracts are in the works to make sure that they can provide us with Sublocade. Our medications for opioid use disorder policy is currently under review once again and revision. We are getting feedback from our prescribers as well as some other agencies on the best way to identify those that would be most appropriate to receive the injectable form of buprenorphine, the long-acting agent known as Sublocade.
Any questions? Thank you. Oh, Ms. Klein.
I have a question, but it's not about MAT.
Okay.
On page 9 of the warden's report, and it said there were 11 commitments to Torrance, but no admissions. I didn't see any admissions. So I just would like some clarification on what commitment to Torrance means.
Commitment is when the commitment hearing takes place. So if somebody is going to be under a 304, a 402, or a 403. So I think most of us are familiar with the terms 302, which is an involuntary commitment in the community. So 304, 402, and 403 are related to those forensic commitments within Torrance. So those commitment orders have been granted, which means that they are currently in our building awaiting their transfer to Torrance. Torrance, like many other agencies, ours included, has had to delay or cease all admissions due to COVID as well. So we work with them in partnership. They have started again, so that's not reflected in this report because we do until the 15th of the month. But since these numbers have been published, we have sent individuals to Torrance and we are currently working to make sure that we can continue that process with them.
So I would assume that while they're awaiting transfer to Torrance, they're housed in your acute mental health unit?
Yes, ma'am. So either the acute, the chronic, or the step-down units for the population. So competency restoration treatment is very specific, expensive, and expansive. While they're with us, we continue to make every effort to get them to restore to competency through other modalities or treatment measures. There are occasions when we are successful at that and they are rechecked and then the commitment is rescinded. But that has not been the recent case for us, and the numbers that are outstanding remain outstanding and will need that higher level of care.
And this is a statewide problem, Ms. Klein. We talked, Judge Lazara and I talked to judges all across Pennsylvania, because one, there's just not enough beds. They have over years closed mental health hospitals. And so, you know, sometimes even in the best of times before COVID, sometimes there was just a wait for bed availability. But so the judge has issued the order to commit and they're waiting for transport, basically. Yes, Ms. Klein.
Would it be possible to put on the warden's report how long people are waiting? And I understand that's no reflection on you. It's a reflection on there not being beds at Torrance, but just so that I think that would just be helpful information for us to know about really significantly mentally ill people awaiting treatment in ACJ.
Can we put that on there? Like either when the commitment order was entered? You know,
that's not something that we presently track, but that is something that we could. So we are primarily focused on continuing to offer and provide treatment while they're in our custody. I hate to say that the length of time that they wait, it doesn't really impact how we're going to provide care to them here. So that's why we don't track it. But I do understand a large number of entities, including some legal organizations, would probably like that information.
I think it would be useful and for the court too. I mean, I think at some point, you know, who knows? But if you're able to provide that information just in a report, it doesn't have for the board to look at. That would be greatly appreciated. If you
I'll try to work on that for next month, Your Honor.
If you have any stumbling blocks or something, just let me know. But I think it would be useful. I mean, just to know that. Ms. Hallam, did you have your hand up?
No, I was just going to ask the same question that Ms. Klein asked about the wait time, because I remember the ACLU put out a report a few years ago that like Pennsylvania has the longest wait times in the nation for people waiting to go to a place like Torrance. So I was just wondering also what our average times are.
And as bad as we think it's here, I think our colleagues in Philadelphia, the judges in Philadelphia, it's much worse there. So it's not a good situation, but it's not obviously in the control of the jail. So, but it would be helpful to know. I don't know. Sometimes if you know, and maybe something can happen. I don't know what that is. I have no answer, but I think it would just be useful to know. All right. Thank you. Chief Williams, anything else that you want to report on today?
I can make comment that the healthcare record implementation has not yet taken place. With that organization, we've had a couple of builds related to COVID and specifically managing the booster, tracking that have jumped the line and getting that worked out. But as soon as that module is implemented, I will provide update.
All right, thank you. Any other questions for Chief Williams? All right, and thank you again for your very thorough reporting. It's greatly appreciated. We'll move to new business. We have 2 items under new business. Ms. Hallam.
Thank you, Judge Clark. Okay, so the first one, a motion to request money from the Incarcerated Individual Welfare Fund to be put on the commissary accounts of each person in the ACJ. As of the time that I drafted this motion, there were 1,628 folks incarcerated in the jail. The motion is for $50 for each person. Total cost would be $81,400. I'd like to make a motion to approve.
Is there a second? Second by Judge Lazara. Any discussion? All those in favor?
Aye.
Aye.
All right, the motion is carried. Ms. Hallam.
Thank you. Next motion is a motion to request money from the Incarcerated Individuals Welfare Fund to be put on the tablet accounts of each person. Again, 1,628 folks incarcerated in the jail. $50 for each person is a total cost of $81,400. I would like to make a motion to approve.
Is there a second? All right, Judge Lazara made a second. Any discussion? All those in favor?
Aye.
Aye.
Any opposed? All right, the motion is approved. Thank you. Any other new business at this time? Any old business? All right, if not, I would entertain a motion to adjourn and we'll go into executive session.
Okay, 1 minute. Yes, if I'm on this phone, can I still, is there a number for me to call for executive
No,
session?
you'll just stay on. You'll just stay on.
Okay.
So what
Just
I
to
would-
clarify before we go into executive session, is this only for members of the board, or are there other folks who are going to be in the executive session as well?
What's for
Executive
board
session
members
is-
and board-
Your Honor, I was going to ask in light of this John Backrack, I'm sorry. I was going to ask in light of the discussion if I could sit in
Is
on
anyone
behalf, for the
solicitor sitting in?
provide some advice if necessary to the warden.
That would be great.
I'm sorry, did you say, you broke up, Ms. Hallam. I don't know which.
Oh, I'm sorry. I just think that it would be very helpful to have a solicitor's input on the legality of some of the things we're discussing in executive session. I was more asking about like proxies and, you know, those sort of things if they are going to be in executive session.
So,
because it's one thing to send one for a meeting, it's another thing in an executive session. I'm just wondering what the rules are on that.
well, executive session usually includes just the board, but it also includes those other folks that the board designates to receive information from. So obviously the warden and Chief Williams are not members of the board, but they would be in the executive session because there's no sense in having it because the warden has to answer the questions. Mr. Bacharach has asked to stay and you thought that was a good idea. So I personally think because it might be a good idea for Mr. Pilarski to stay, but even though he's technically not a member of the board. But all the other people, you know, we have the community corrections people. I see Mr. Shearer from probation is there. All of those folks would have to exit.
Okay, I would just like to for the record enter that I do not think that non-board members that are not invited by the board should be in the executive session, such as proxies. So,
Well, I would like to invite Mr. Pilarski, so if there's no objection.
I object.
All right, does anyone else object?
Who did you want to invite? I didn't hear that. Something cut off.
Steve Pilarski, Mr. Pilarski from the county executive's office.
Well, is he representing the county exec?
Well, he was here in his place today.
Mm-hmm.
So that's up to you to object. I would like to invite him to stay because there may be some useful things that, you know, we could.
Well, no, I'm not objecting. I just wanted to understand what, because I got cut off. I didn't hear all of it.
All right.
No,
So-
I'm objecting.
All right, thank you, Ms. Howell.
Thank you, Your Honor.
All right, so can we have a motion to adjourn? The
So
regular.
So moved.
All right, so there's a motion to adjourn. It doesn't need a second. All those in favor?
Aye.
Any opposed? All right, so we'll move into executive session.